So I'm going to talk today a little bit about Senecavirus in boars, which is a black box up to this point. This is a collaboration with numerous people, so it's not just myself. Fabio is included as well as a number of other veterinarians and industry representatives. So with that, here we go. So I'm going to give you a little bit of background of what we knew about Senecavirus in boars. I'll go through 2 case reports of 2 naturally infected boars from one farm. Some interesting findings there. Shedding that was occurring in the semen, as well as the tissue distribution and necropsy. And then I'll go through some of our experimental findings that we had with boars that we inoculated, and bring it back to some take-home messages that I hope will be valuable to veterinarians and the industry in general. All right, so we know very little about Senecavirus in boars. One of the first published case reports back in 2012 with Singh reported a case of vesicular disease affecting a 6-month-old intact boar. So we knew that boars are susceptible. They weren't some magical part of the pig species. But there was no discussion of the reproductive organs, so we don't have any idea as far as lesions that may or may not have been present. Canning et al. Reported on a sow herd in Iowa where the sow herd had been experiencing vesicular disease. They sampled a teaser boar on that site that was recovering from vesicular disease, and that boar had PCR positive, CT value of 34.4, but was VI negative, collected at a follow-up visit to that farm. And so this highlights a potential risk factor, a biosecurity risk, that semen might be of interest in Senecavirus. So the case history of the naturally infected farm, this is January 2017 in a Minnesota sow farm. The farm started having increased neonatal mortality. They had some scours, and they had sent some cases in, and then subsequent to that, they developed vesicular disease on that farm, and a foreign animal disease investigation was launched. That farm was negative for foot and mouth disease, but positive for Senecavirus. And so on that farm, there were 2 boars that did develop vesicular disease. And they are contributing quite a bit to science and to our understanding of this virus in reproduction. So I kept them in here, Leroy and Richard. And so you'll see the information that they provided to science and to help pig production as well. So semen was collected approximately weekly. There are some here or there. And I should point out that Richard lived up to his name, and so he wasn't collected quite as frequently. And so most of the collection points are from Leroy, but Richard does appear on occasion. So necropsies were performed at about 3 months or 92 days after the appearance of vesicles on farm. I would point out that all my time points for this naturally infected is from that foreign animal disease investigation. And so as part of the herd closure and then reopening, these boars were euthanized, and we were able to get those tissues to take a look at what was going on, and was an important part of our investigation. So this is a chart or a graph showing the kind of distribution and CT values of semen shedding. So these boars were initially collected on day 9, and so this blue line right here are all Leroy points. The orange are Richard, and so both of these boars were positive at multiple time points. We know it started as early as day 9. It peaked as far as the lowest CT value, or the most amount of viral particles or viral RNA in the semen, was about a month and a half to 2 months post appearance of vesicles, and then it kind of climbed back up again, and the last collection point was at day 91, and we necropsied these boars on day 92. So quite a prolonged period of shedding, and it was consistent. It wasn't a one-time thing. You know, like Fabio likes to say, if it's one, it's a miracle, and if it's more than one, it might be science. So we've got more than one boar, and at more than one time point has positive for Senecavirus in the semen. I would also point out, I'm not going to present it here, these boars were sampled for fecal, oral, and blood, and so they were collected later on in the course, and so they were negative in all 3 of those samples, and they were also positive for IgG by IFA, I think that collection was here at day 75. So we still had SVA. I'll say SVA for Senecavirus as they go along, even in the face of IgG present in the serum. This is the necropsy data. This was collected at day 92, and this is showing the tissue distribution. I do apologize. I didn't realize it was going to be so tiny up here. So hopefully you can see it in the back. If not, you can look online. The features that I would point out here is there are two tissues that are strongly positive or moderately strongly positive. This right here, again, Leroy is blue, Richard is orange, is the testis. So in the testis, Richard had a CT value of 19, and Leroy had a CT value of 23. And so very strong positives coming out of the testis. They were also both moderately positive in the tonsil, and so that brought up these tissues right here. If you look down here, there's accessory sex glands, the prepuce, and so those would be potentially, if you have a strong positive in the testis and you're potentially shedding throughout that whole tract, you might be able to explain some of these numbers up here. But the tonsil is quite far removed from the reproductive tract, and so this is also an interesting finding that at 92 days post-infection, we've got viral RNA hanging out. I would point out there's the tissue homogenin, or TSHM here, would be lung, spleen, kidney, some of these other non-reproductive organs and things that we would be putting into a homogenate, and both of those Boars were negative on that sample. Just to point out, I don't always, I guess sometimes I forget. We look at CT values and we say 1, 2, 3. Remember that a 1-point change in CT value is not a linear change. It's an exponential change. So this looks like the inverted. So this is based on our standard curve. So this brings back the question of suspect versus positive versus negative. Our suspect is based on the point at which we would say the TCID 50 would be negative or 0. And so this is based on our standard curve. Our CT value cutoff for positive is below 36. So beyond that, you would question whether or not some of this positivity is a non-specific amplification of some RNA in there. And so this is a log scale. And so it looks like it fits with our CT values, but I would remind people that on a linear scale, it looks very different. And so that testis of Richard had estimated 50-some thousand viral RNA or TCID 50 copies per mil, versus Leroy's, which was at a 23, has only about 3,000. So just to remind you that CT values are exponential and not arithmetic or linear. So there's an awful lot more virus in that testis than any of the other tissues. Oh, that's blurry. Maybe it's the projection. So what this is, I'll just briefly go through this. This is some histopath images from the affected Boars. So this is testis right here. I would point out the features to note here are these white tubules that you see coursing throughout here. And so what those are kind of inactive or degenerate seminiferous tubules. They're not filled with developing spermatids and spermatogonia. The other thing that I would point out is these kind of bluish black pockets that are throughout here. And I'll show those as well. Those are areas where there's infiltration of inflammatory cells. And so these Boars did develop kind of a chronic orchitis. So this is those white tubules here. So just to kind of orient you, the relatively normal seminiferous tubules would be these right here, where you can see these little dit dots, and those are developing spermatogonia. And then these tubules right here are empty and they don't have any of those developing. Some of them, like this one right here, has actual inflammatory cells kind of crossing over and affecting those Sertoli cells and causing problems. There's also a little focus right here, looks a little darker purple, and that's lymphocytes, some kind of chronic inflammatory cells. Higher magnification showing those areas where there was kind of purplish that you could see on the subgross. Again, this right here is a normal tubule, seminiferous tubule. These right here are normal interstitial cells. These pink cells, these are creating your steroid. And then these right here are abnormal. These are infiltrates of lymphocytes, plasma cells, and very few macrophages. And then you can see the remnants of what used to be seminiferous tubules that have been kind of replaced by the inflammation. And so these Boars had orchitis, both of them, and it was in multiple sections of testis. This is in situ hybridization that is specific to Senecavirus A. And so what this image is showing is again, you see the empty tubule, but in that inflammatory population, or in the region of where those inflammatory cells are, there's a strong red color. That strong red color correlates with a signal that's based. So this is pretty much like PCR on tissues. This is looking for mRNA to the virus. It's not looking for antigen. We don't have antibodies that we can test for Senecavirus A antigen, but this is looking for the RNA in the tissue itself. And so very strongly correlated here with the inflammation, as we have presence of mRNA for that virus. This is a subgrowth of the spermatic cord, and I would point out these lumen right here. That's the pampiniform plexus. That's your blood vessels as they course through there. But these structures right here are not usually there. These are areas of lymphoid hyperplasia. So these very distinct clusters with a pale center are lymphoid follicles. And so those are not necessarily infiltrating, but they're replicating in situ. They're creating their own little lymph node, if you will, right in the tissue. And so this is in the spermatic cord, and so this is draining the testicle. There's obviously some chronic antigenic stimulation that's prompting this lymphoid proliferation, as well as a little bit of edema out here. This is the tonsil from that boar. Looks pretty normal. There is some lymphoid hyperplasia. There's an awful lot of follicles that you can see there, but there's not obvious necrosis or anything like that to cue you that there's anything there. But if we do Senecavirus-ish in situ hybridization on that tonsil, it is strongly positive in multiple tissues. So follicles are pretty much unaffected, but the interfollicular areas have strong signal, as well as here would be a crypt. So remember that the tonsil is one of these kind of lymphoid and epithelial organs, and so there is some subepithelial and intraepithelial signal in these tonsils as well. And this, remember that this is taken 92 days after the appearance of vesicular lesions. So this is pretty striking. Some of the experimental work has shown that even at day 38 in experimentally infected animals, they'll have that same tonsil pattern. So that brings up the question now: what do we do? You know, this fact that we've got positive semen, especially out to 3 months, is concerning. So we need to investigate. You know, is this something that we can reproduce? And in reproduction, does it mimic what we saw? So the objectives of our study was to determine whether mature boars would be susceptible to 2 different Senecavirus A strains. We're going to monitor that through viremia and clinical signs or lesions. And then to determine the viral shedding patterns, if we were able to infect those boars, looking at oral fluids, feces, and semen. And then how is the tissue distribution at necropsy? As far as our viruses, to give you an idea, this is a phylogenetic tree that's constructed on whole genome sequences of Senecavirus A that you can pull off of GenBank and that have been sequenced at the University of Minnesota Veterinary Diagnostic Lab. Give you an idea here, this is the 1988 strains, and these are the 2017, 2016 US strains. Our historical strain that we used was a 1999 isolate, and that was obtained from an aborted porcine fetus that was obtained in Minnesota. We didn't know a Senecavirus at the time, but subsequent to that has been verified to be Senecavirus. The contemporary strain is a 2017 strain, so Leroy, again contributing to science. We isolated a virus on the second passage on his day 9 collection of semen, and so this virus that we used in inoculating the boars actually came from boar semen, and that is here. So these 2 viruses share about 94% of their genome. To give you a perspective, this 88 over here would be about 91% related to the current contemporary strains. All virus isolation except for this 99. I'm not sure exactly what the initial cell line was, but we grew these viruses in a human lung cell cancer line that's highly permissive. And both of these viruses were 4th passage at 5 times 10 to the 7th TCID 50 per mil. For boars, we had 14 mature boars. They had been trained for collection so that we could sample them appropriately. and mimic what might be going on in a boar stud. There was a control group of 2 boars that were sham inoculated. There was a historical group of which 6 boars were part of that, and the contemporary group, another 6 boars. Both boar groups received 6 times 10 to the 8th TCID 50 per boar, which is in line with other experimentally reproduced vesicular disease. I would point out that other published reports are usually in younger pigs, and so we weren't exactly sure how this would go in older, mature animals. And then we sampled quite extensively in the first week because this would be a high-risk period when you might have boars that aren't showing any clinical signs or lesions, but might potentially have risk of shedding in the semen. And so we collected 1, 2, 3, 5, 7, and then weekly thereafter. So we've got our experienced collector here showing the gloved hand technique, which was used to collect these boars. We used the sperm-rich portion after it had been filtered. Interestingly enough, when they're being collected, you can get blood rather easily from the saphenous vein. So that's an image there showing our collection technique for blood. You don't need to snare them necessarily and pull a jug stick. And then we collected oral swabs and fecal swabs because that's potentially what out in the field somebody might be doing for an individual animal. And then swabs of any lesions that developed. So moving on to the data, here are the oral fluid samples. So these are proportion. The top, when I get to the feces and the top will be the proportion, and then the second one I show will be the mean CT values of those that were positive. The historical strain will be shown in blue, and the contemporary strain is shown in orange. The oral swabs in the contemporary strain were all positive at day 1, and they continued to be positive, all positive through day 7. The historical strain were mostly positive by day 1, but by day 2, everybody was positive. So between day 2 and day 7, all boars in both groups were positive in oral fluids. It tails off after that with the contemporary staying positive longer. Looking at the mean CT values of those that were positive, here in the beginning there's a little bit of a, not really sure what's going on there, but then a pattern that we'll see in the other samples as well is that the contemporary boars tend to have a lower CT value. Again, remember that's exponential. In their samples as we go along. But these values run right around the CT30 or higher, with in the early part of the week dipping down into the lower 20s, or upper 20s, I should say. On feces, it's a little bit more sporadic and not as straightforward. The boars were positive on day 1, but not very many. Day 2, there were both groups had a few that were positive, and then that contemporary group went positive on day 3 and stayed positive all the way out through day 22. So about 3 weeks they shed in the feces consistently, all of them. The historical group had a little bit more business that was jumping around, but that day 7 to day 14 window, all were positive on those 2 collection points. CT values are somewhat similar to the oral fluids, and again shows that line where the contemporary group tends to have more virus potentially in their secretions. This is the serum. So we had talked about whether or not you can find it in the serum and at what point you can. The serum goes positive, at least in our study, on day 1, and it stays positive only until day 3 for all of the historical boars, and then they start to fall off, and it was only positive until day 5 on all boars on the contemporary strain, and then it starts to fall off as well. And so it highlights the fact that these animals are not viremic for very long. Some of them can be viremic for an extended period of time. So this one boar right here was positive out to 2 weeks when we pulled his serum, but it doesn't last very long. CT values are much lower. When you look at the mean values here, we're quite a bit lower than those 30s that we had seen in the other samples. And again, this last one here at day 14 was right on the cusp of being called suspect. Semen is a bit jumpier as far as the data goes, but I would point out that we have a boar positive on day 1, and then we have several boars. This would be correlated with 4 boars. 4 out of 6 boars in the contemporary group are positive on day 2. Only one of the historical boars was ever positive in the semen, and that was on day 2. That CT value of that historical boar was right on the cusp of being called suspect, but very high CT values in the semen. And then just showing seroconversion, the first few boars were positive on day 5, and then more on day 7. By day 14, all boars are positive on our IFA based on IgG. Here are the tissue types. So these tissues are collected at day 49. And so things that I would point out here is that all boars, regardless of group, were PCR positive in the tonsil, and they were also positive on the lymph nodes of the head, and so this would include the retropharyngeal and the mandibular lymph nodes. A fair number were positive on the testes within the contemporary group. And then the other feature that we pointed out I wanted to point out here is the fact that a tonsil swab is not the same as tonsil. And so at the time of necropsy, we collected a tonsil swab. It was a good rough swab of that epithelial surface that you can get to. And on these contemporary boars, we had 1 boar that was positive. And on the historical boars, we had 4 boars that were positive, but it's not the same. Tonsil is not the same as tonsil swab. So keep that in mind when you're sampling. This is the mean CT value by tissues. Again, we've got lower values here for the tonsil and for the head lymph nodes. And then there are this one here is one of the salivary glands, had a CT value of 23, which was pulling things down. But who knows, maybe there was some lymphoid tissue that was part of that. But those would be 2 kind of highlights. And again, looking at those tonsil versus tonsil swab, tonsil values are down here at about CT 25, and the tonsil swabs are all north of 30. And so tonsil swab does not equal tonsil if you're out there trying to collect samples. So as far as development of clinical signs, so you were talking about incubation period. I think somebody had asked earlier. The typical incubation is at about day 3. Published reports have vesicles appearing. Ours right here, boar number 11, he was the boar that was shedding out to 3 weeks on his semen and had viremia that was out to a little over 2 weeks. He had this lesion right here show up at day 2. We thought initially maybe it was a trauma, like he had bumped it on something, but it was just a blanched area that was starting to tear on the caudal aspect. We swabbed that, thinking, well, maybe it's something, but that came back at a CT value of 20. And so his oral fluids was a CT 24 and feces were a CT 27, and so unlikely to have been due to anything else. And so in this case, there was a really subtle looking lesion, especially if maybe he did bump it during collection or something like that. But that showed up at day 2. Usually the published reports are between day 3 and day 7 is when your appearance of lesions would be, so your incubation period. This same boar also developed kind of an ulcerated lesion there at the coronary band at the junction of the sole and the hoof wall in the left rear. He was moderately lame. That was transient. He did recover from that, but he was reluctant to mount the dummy. He did mount every time we asked, but that would be something that boar stud would potentially worry about and should throw a flag up if you've got a boar that doesn't want to get up on his rear feet. That lesion swab again was CT 23, so was consistent with it. We did not collect any samples for histopath on these boars. We didn't want to kill the golden goose too early. Second boar, again contemporary strain, boar 9. He showed a lesion at day 3. And so this kind of circumscribed lesion here is showing a ruptured lesion. We didn't see the intact vesicle, but that was a CT value 24. These 2 were it. So Hansu, in answer to your question about how many could be infected and be positive, we know for a fact that at least 10 out of 12 Senecavirus infected boars were positive but didn't show lesions. And so a large proportion didn't show lesions. So I would not be surprised to have an infected animal that doesn't show any clinical signs. None of these boars went off feed. They still were gobbling it up like nobody's business. And other than the one that had the foot lesion, he was moderately lame. They didn't show any clinical signs other than that. At necropsy, there weren't real exciting lesions. It doesn't show up very well. This is the testis from that boar that I just showed you that shed for 3 weeks. This right here is thicker than it should be. And so that's the pampiniform plexus, the spermatic cord as it goes through there. And that's expanded by that same kind of lymphoid follicular hyperplasia I showed you on the naturally infected boar. And then this one also had some edema. You can't really tell, but this is a little bit yellow in there. So that's plugging up the drainage of the lymphatics throughout there. So there was some lymphoid edema, or lymphoid hyperplasia and edema, but nothing real spectacular. Just a quick follow-up. I didn't have a lot of time to spend on it, but we've got Senecavirus infected boars with semen, and so one of the logical questions is, can you infect gilts with that semen? And so this, I would point out, this is a very small pilot study, but 5 gilts were inseminated with positive, PCR positive semen. That was the lowest CT values we had were 30 and 33, and those were from contemporary boars on day 5 collection. There were 2 gilts that were inseminated with control semen, and then we sampled oral fluids, feces, and serum, and necropsied those boars or those gilts at day 35 post-insemination. And so, in our small pilot study, none of these gilts shed virus, and none of them were PCR positive in the maternal or the fetal tissues at necropsy. None of these gilts seroconverted, and there was no difference in fetus numbers between the 2 groups. So our conclusions here are that mature boars are susceptible to infection to both historical and contemporary strains of Senecavirus A. These boars shed viral RNA in oral fluids, feces, and semen. Oral fluids, all boars are positive between days 2 and 7, and then it gets patchy after that. If you're collecting oral fluids by rope sample in a pen, maybe you can get around the fact that it's patchy in individual animals. And again, feces are the same, so they were all positive in all boars at day 7 through 14. But is variable in other time points. And so again, if you're going to collect multiple animals, hopefully you can get around this variability that appears in at least our ability to test. And semen, one of the high points would be that we had 1 boar that was shedding very small amounts of virus at day 1, but all contemporary strain boars were positive in semen at least 1 collection point, and multiple boars were positive at 1 or more. Day 5, all of them were positive. And then that 1 was positive out to 3 weeks. Only 1 historical strain boar was positive, low amounts day 2. These lesions and clinical signs were apparent in the minority of animals that were infected, only 2 out of the 6 in those contemporary strain, and nobody in the historical strain showed any clinical signs or lesions. And then these tonsil and head lymph nodes were positive in all boars, quite a far distance out from infection. And then we're going to be doing some testing to see where it is. More than likely expect it similar as far as distribution as previously shown. So take-home messages that I hope you take away is that boars that are naturally infected have the potential to shed virus for up to 91 days after the development of vesicular lesions. Virus was isolated from the semen of that 1 boar, and that was taken at 9 days post. All other samples that were tested by virus isolation were negative. 5 passes on that lung cancer cell. Boars that were experimentally infected had also were shedding positive RNA in the semen, with 1 boar that was out to 22 days post inoculation. Clinical signs are not manifested in the majority of our experimental animals. Again, these are older animals. They're going to have potentially tougher skin, and so maybe the vesicles don't pop out as easily. I'm not exactly sure. And then gilts I would highlight this is a small. 5 is not 50, is not 500, but at least in our 5, we weren't able to infect them through artificial insemination. So I'd like to thank all the collaborators here. Rapid Agriculture Response Fund and the Swine Disease Eradication Center funded both parts of the naturally infected screening as well as the experimental design. Our folks working tirelessly at the VDL, PCR, serology, virology, all helping out there, as well as necropsy. I don't recommend anybody ever try to necropsy 12 boars in 1 day. It's not a good idea. And then New Fashion Pork, Reich's Veterinary Research and Consulting, Swine Services Unlimited, and PIC are also important with that.